You're still watching Today with myself, Mfundo Mabalane. Now, President Cyril Ramaphosa says the country is experiencing a rate of COVID-19 infections not seen since the start of the pandemic. He's urging people to get vaccinated. Ramaphosa says the number of daily infections has increased fivefold in the past week. In his weekly newsletter, Ramaphosa says he will convene the National Coronavirus Command Council soon. That's to review the state of the COVID-19 pandemic. Ramaphosa says vaccinations are the most effective means of curbing the spread. It also reduces severe illness, hospitalization and death. Hospitals are also preparing to admit more patients, and government is investigating how it can quickly secure medication to treat COVID-19. Now, amid concerns over the low number of vaccinations across the country, several companies have adopted mandatory vaccine policies. To unpack this further, I'm now joined by Ethnographer Carmen Murray. Carmen, thank you very much for joining us this afternoon. Now, if current reports are anything to go by, it seems we're headed for those mandatory vaccines by next year. But what are you observing in terms of online sentiment around mandatory vaccines?
Thank you so much. It's great to be on your show. One of the things that we're definitely starting to notice, and we actually did a poll recently, and people are so split up between this idea of getting vaccinated. 50% of about 700 people believe that they would be, they will completely have a compulsory vaccination. 40% said no way, and 10% said they would consider it. So we've got our anti-vaxxers, but we also have people with COVID guilt. So we can't necessarily see all the conversations that needs to happen online, purely because people are keeping quiet because they've had their vaccinations. But we should really be out there in the streets telling everybody that we know what's going on, that they should get vaccinations, because these vaccinations are truly making or giving results at these numbers at an alarming rate. One can't afford not to have it. Just today, we found out that over 16 million people living in South Africa have been vaccinated, which means 35% of adults and only 23.7% of the adult population. That is scary.
No, it most certainly is very scary. But if we had to focus on just this number of people who are ambivalent, what does this grouping really want to see? Are they possibly on some sort of watch and see what happens? We're looking for more information around COVID at this point?
Definitely the conversation that we're seeing online, you will have a lot of people, and it's quite interesting, a lot of people have this perception, okay, that this person is against getting vaccinated because they believe in some conspiracy theory. But some people are like, I want to know what I'm putting inside my body. There's people having conversations, they want to have a baby, they're not sure if they should do it, they have been using IVF. You see these kind of conversation also happening online. Then you've got people that, and you're seeing a lot of companies that are making vaccinations compulsory. So if you want to enter the workforce, you need to get a vaccination. Therefore, if you don't, it's all about work safety. And there's a lot of conversation. The research is showing us that it's not a conversation that people are really opened up to. What the big concern is for us as a continent is only 6.8% of our continent has been vaccinated. The quota is 40%. There's only 5 countries in Africa that has made this mandate.
But then, Carmen, I'd say possibly from what we've observed on social media, part of the hesitancy is driven there on social media because there's quite a lot of misinformation there. And then possibly that's what ends up happening, where we don't see a lot of people actually going to vaccinate. Is that what you're also observing?
100%. But also what we are observing is that we don't have a massive digital population. There's still such a huge digital divide within South Africa. So what's happening on the ground? I saw a recent report this morning, actually, where the government is going to the pastors and asking them, please, can you assist us in order to do vaccinations at the churches? And they said, only it comes at a price. You have to pay us money. So these conversations are also, making people question, what's the intentions there. But from this, it's starting to look a lot more political. I don't know if you saw the video that went viral by Dr. Ayode, I do apologize if I'm not saying this, Alakia from Nigeria. That video almost had the whole world on fire, and we saw, this is how we detected it on social media, from LinkedIn, Facebook, etc. And one thing that she truly said is that this is like a shape or form of xenophobia. You can't just put a continent into this basket and say, okay, right, we are just going to isolate you from the rest of the world because you don't have a high vaccination rate. But they're hoarding vaccinations. If you look at what happened with Moderna, I went to go and check out the actual research. 500,000 vaccinations were ordered by Moderna. They hoarded it, and then they held it back, and then they gave it to another wealthy country. So what's happening is they're charging African countries double the amount that they would charge wealthy countries. And this is becoming, for some countries like the Biden administration, it's becoming a big concern as to how Africa is being treated throughout this whole vaccination process. And I quote that it's Moderna is doing the racing for profits. And they are trying to avoid the conversation, but research is showing us that this is indeed a massive concern. And the online community refers to it as the vaccination apartheid, vaccination
So
xenophobia.
unfortunate that they could be pushing profits at the expense of health. I know what she went on to speak about as well was that clearly what we're seeing now in terms of those travel bans is not necessarily bans informed by science, but perhaps geopolitics, something where we might not be that much of a strategic partner to certain countries. It would be so easy to ban Africans. But nevertheless, what is being said online about Omicron itself? Following that announcement, are we seeing a bit more apprehension or people more observant of some of these health protocols?
I do see online, as I'm looking at the various conversations happening online and on social media, what we are seeing is that people in the beginning were like, oh no, this is not something serious, we've got this under control, it's just like a standard flu. And as we are seeing the daily alarming increases happening, you can see the conversations are, I'm not going to go away for this holiday. I've decided my family and I are going to stay at home. You can start, people are basing their decisions on what's going on around them. If you drive past restaurants, I do think that we're starting to see slow change in behavior, but we'll only know once the festive season starts. But I also need to point out, one of the big things that we have noticed in the past 12 months is doom scrolling and COVID fatigue. People have become so tired of hearing the same old conversation over and over and over that it's almost like they're deaf to it. The sentiment analysis is showing us like 57% of people not really talking about COVID. We've got a high negative sentiment, but the problem is what's happening on the ground, because there's only a certain amount of people that's actually online. We can't just go by what people are saying online. It's what's happening with the people that don't have access to data or to smartphones. And that's something
they
that
are in fact the majority. Correct. No, Carmen, thank you very much. Unfortunately, we've run out of time. That was Ethnographer Carmen Murray just giving us sentiments online pertaining Omicron, the mandatory vaccines that could possibly come into play, also the travel bans. So a very interesting conversation that we'll continually be updating you on. To this now.